I want you to think about the last meal you ate. Maybe it was an hour ago. Maybe it was this morning. Whatever it was, something happened inside your body within minutes of that last bite that most people over 60 have absolutely no idea is occurring. Your blood sugar spiked, not because you ate something wrong, not because you have no willpower, but because after 60, the biological machinery your body uses to manage glucose after a meal becomes significantly less efficient. And that inefficiency, happening 3 times a day, every single day, is quietly doing damage that accumulates over years before it ever shows up on a blood test. Here is what nobody tells you. The most dangerous moment for your blood sugar is not when you are fasting. It is not overnight. It is the 90 minutes immediately following every meal you eat. That window is called the postprandial period, and what happens inside your arteries, your brain, your kidneys, and your heart during that window has now been studied extensively enough that I can tell you something with complete confidence. What you do in the 15 minutes after you finish eating matters more for your long-term blood sugar control than almost any dietary change you could make. And today, I am going to show you exactly what that is. My name is Dr. Michael Ellis. I am 85 years old, and I have spent my entire career in preventive medicine working specifically with adults over 60 on metabolic health and blood sugar management. And what I am about to share with you is backed by peer-reviewed research, including a study published in a leading sports medicine journal that found one specific physical movement performed after meals reduced post-meal blood sugar spikes by up to 52% in adults with and without diabetes. 52%. From one simple move. No medication, no equipment, no gym membership. Before we go any further, I need to ask you something important. Drop a comment below right now and tell me this. Do you check your blood sugar after meals? And have you ever noticed how different you feel 1 hour after eating versus 2 hours after? Write yes or no in the comments. I read every single one personally, and your answer tells me exactly where this community needs the most support. Now let us get into the biology first. Because once you understand what is actually happening inside your body after every meal, this simple move will make complete sense and you will never skip it again. What happens inside your body after every meal? The moment food enters your digestive system, your body begins breaking down carbohydrates into glucose. That glucose enters your bloodstream and your blood sugar begins to rise. This is completely normal. It happens in every human being after every meal, regardless of age. But here is where age changes everything. In a healthy younger adult, the pancreas detects rising blood sugar almost instantly and releases a surge of insulin. Insulin acts like a key that unlocks your muscle cells, allowing glucose to flow out of the bloodstream and into the muscles where it gets used for energy. Blood sugar rises briefly and then comes back down smoothly within about 90 minutes. After 60, this system begins to break down in 2 specific ways. First, insulin sensitivity declines. Your muscle cells become less responsive to insulin's signal. The key still works, but the lock has become stiff and resistant. More insulin is needed to move the same amount of glucose out of the blood. And if the pancreas cannot keep up with that increased demand, blood sugar stays elevated longer than it should. Second, and this is the part that most people are never told, muscle mass declines with age in a process called sarcopenia. This matters enormously for blood sugar because your muscles are the primary destination for post-meal glucose. Less muscle mass means less storage capacity for incoming glucose. The same amount of food produces a higher and longer-lasting blood sugar spike in a 65-year-old than in a 35-year-old, even if they eat the identical meal. This combination of reduced insulin sensitivity and reduced muscle mass creates what researchers call exaggerated postprandial hyperglycemia, a fancy term for blood sugar that spikes too high and stays high too long after every single meal. And that chronic postprandial elevation, even in people who are not diabetic, has been directly linked in peer-reviewed research to accelerated arterial damage, increased cardiovascular risk, cognitive decline, kidney stress, and inflammation throughout the body. Here is the critical insight. Your fasting blood sugar, the number your doctor checks at your annual physical, may look perfectly fine, but if your post-meal spikes are chronically elevated, damage is still accumulating. And most people never know because nobody checks their blood sugar after meals in a routine appointment. Now here is the simple move that changes all of this. The move, post-meal walking. The simple move is walking. But not just any walking. post-meal walking, specifically timed, specifically dosed. And the difference in timing and duration between walking that produces dramatic results and walking that produces almost none is something most people have never been told. A 2022 study published in Sports Medicine examined the effects of different walking protocols on post-meal blood sugar in adults with and without type 2 diabetes. The findings were remarkable. Participants who took a gentle 2 to 5 minute walk after every meal reduced their post-meal blood sugar spikes by an average of 52% compared to those who remained seated. Not a 30-minute walk, not a vigorous workout, 2 to 5 minutes of gentle, easy walking after eating. A separate study published in Diabetologia compared the effects of one 30-minute walk per day against 3 10-minute walks taken after each meal. The post-meal walkers showed significantly better 24-hour blood sugar control than the single-session walkers, despite accumulating the same total walking time. The timing is everything. Starting within 15 minutes of finishing your meal captures the peak of the blood sugar rise before it reaches its highest point. Waiting more than 30 minutes after eating significantly reduces the benefit. Here's why this works at the biological level. When you walk, your leg muscles contract. Muscle contraction is one of the only mechanisms in the human body that moves glucose from the bloodstream into the muscle cells completely independently of insulin. This is called non-insulin-mediated glucose uptake. Your muscles have a second door that opens with physical movement rather than with the insulin key, and that second door works perfectly even in people with significant insulin resistance. So when you walk after a meal, your contracting leg muscles begin pulling glucose directly out of your bloodstream. They are acting as a biological sponge, absorbing the very glucose spike that would otherwise sit in your circulation, damaging your blood vessels for the next 2 hours. And at 85 years old, I can tell you personally, this is the single most underutilized tool in blood sugar management for older adults. Because it requires nothing except the willingness to get up from the table. Type the number 52 in the comments right now if this is making sense to you, because that number represents something genuinely life-changing for anyone managing their blood sugar after 60. Why most people are not doing this. If this is so simple and so well researched, why are most people over 60 not doing it after every meal? 3 reasons, and understanding them is what will stop you from falling into the same traps. Reason 1. The after-meal fatigue trap. Many adults over 60 experience a natural drop in energy 20 to 30 minutes after eating. This is partly caused by the very blood sugar spike we have been discussing. As blood sugar rises sharply and then begins to fall, energy levels drop. The couch becomes extremely appealing. The last thing the body seems to want is movement. But this is precisely the moment when movement is most needed. The fatigue you feel after meals is not a signal to rest. It is a symptom of the blood sugar process that walking directly corrects. Reason 2. The all-or-nothing mindset. Most people think exercise needs to be 30 minutes minimum to count, so they do nothing because they do not have 30 minutes or because they do not feel well enough for a full session. The research is unambiguous here. 2 to 5 minutes is enough. The threshold for benefit is remarkably low. Knowing that a 2-minute gentle walk after breakfast produces measurable blood sugar improvement removes every excuse for inaction. Reason 3. Nobody ever told them. In a standard 15-minute appointment covering blood pressure, medications, and lab results, there is simply no time for a physician to explain postprandial glucose management in meaningful depth. Most patients leave with a prescription or a dietary handout, and no understanding of the single most powerful behavioral tool available to them. That gap is exactly why this video exists. How to do this correctly, the complete protocol. Here is the exact protocol based on the research evidence. Timing. Begin walking within 15 minutes of finishing your last bite. Not after you have digested, not after you have rested, within 15 minutes. Set a timer if you need to. The 15-minute window is when the glucose from your meal is entering your bloodstream most rapidly. This is the window where the biological sponge effect of muscle contraction is most powerful. Duration: 2 to 5 minutes minimum. 10 minutes is ideal if you are able. Beyond 10 minutes, the additional blood sugar benefit begins to plateau. You do not need to walk longer than 10 minutes to capture the full effect of this intervention. Intensity, gentle and easy. This is not exercise in the traditional sense. You are not trying to elevate your heart rate significantly or work up a sweat. A comfortable conversational pace is exactly right. If you are slightly breathless, you are walking too fast. The goal is sustained gentle muscle contraction, not cardiovascular exertion. Frequency. After every meal, breakfast, lunch, and dinner. The research comparing one 30-minute daily walk against 3 post-meal walks consistently shows the 3 post-meal walks produce superior blood sugar outcomes. Every meal is an opportunity. Every meal is a blood sugar event. Every meal deserves a 2 to 5 minute response. Surface. Any flat surface. Inside your home, around your garden, down your hallway, around the block. Location is completely irrelevant. The biology does not care where you walk. Safety note for those with balance concerns. If outdoor walking feels unsafe after meals, walking in place in your kitchen or living room for 2 to 5 minutes produces similar glucose-lowering benefits, according to research comparing different forms of post-meal movement. The key is muscle contraction in the legs. The location and the specific movement pattern matter far less than the timing and consistency. What to combine this with for maximum effect? Post-meal walking is your foundation, but 3 supporting habits amplify its blood sugar benefits significantly when practiced consistently alongside it. First, eat protein and vegetables before carbohydrates at every meal. Research published in Diabetes Care found that eating protein and fiber-rich vegetables at the beginning of a meal before consuming any carbohydrates reduced post-meal blood sugar spikes by up to 37%, independent of total calorie intake. The order in which food enters your stomach changes the rate at which glucose enters your bloodstream. Protein and fiber create a physical barrier that slows carbohydrate absorption. Combined with post-meal walking, the 2 interventions together can reduce your postprandial glucose response by more than 70% compared to eating carbohydrates first and remaining seated afterward. Second, do not drink fruit juice or sweetened beverages with meals. Liquid carbohydrates bypass the digestive slowdown that solid food produces and spike blood sugar almost immediately. Even 100% fruit juice produces a glucose response in older adults that is dramatically sharper than eating the equivalent whole fruit. Water, plain herbal tea, or sparkling water with meals keeps the blood sugar baseline lower before walking even begins. Third, include resistance exercise 2 to 3 times per week. Post-meal walking addresses the immediate spike. Resistance training, even gentle bodyweight exercises like seated leg raises, wall push-ups, or light dumbbell work, rebuilds the muscle mass that aging depletes. More muscle mass means more glucose storage capacity, which means lower baseline blood sugar responses to every meal you eat for the rest of your life. The 2 interventions work on different timescales. Walking works today, resistance training works over months. Both are necessary for complete blood sugar management after 60. Type the word MOVE in the comments if you are going to start this after your next meal, because that one word tells me you are ready to take this seriously, and it helps me see how many people in this community are taking action today. A word about medication. If you are currently taking metformin, insulin, or any other blood sugar medication, please do not stop or adjust your dosage based on anything in this video. This protocol works powerfully alongside medication. It does not replace it. What it may do over time with consistent daily practice is improve your blood sugar numbers enough that your physician considers reducing your dosage. That conversation belongs between you and your doctor, armed with your own blood sugar data collected over weeks of consistent practice. If you have a continuous glucose monitor or a home glucometer, use it to measure your blood sugar 30 minutes after a meal on a day when you do not walk, and then again 30 minutes after a meal on a day when you do walk. The difference you see in your own numbers will be more convincing than any study I can cite. Your own data is the most powerful motivator that exists. Your starting plan beginning today. After you finish watching this video and before you eat your next meal, write these 3 things on a piece of paper and put it on your dining table. Number 1. Eat protein and vegetables first before any carbohydrates. Number 2. Set a timer for 15 minutes after my last bite. Number 3. When the timer goes off, get up and walk for at least 2 minutes. That is the entire system. 3 steps, 2 minutes minimum, after every meal. Starting today. The 52% reduction in post-meal blood sugar spikes that the research documents does not require perfect execution. It does not require expensive equipment. It does not require you to be fit or fast or to walk any particular distance. It requires you to get up from the table within 15 minutes and move your legs gently for 2 minutes. After 85 years of practicing medicine and studying the research on metabolic health in older adults, I can tell you this with complete conviction. The gap between people who manage their blood sugar well into their 70s and 80s and people who do not is rarely about medication or genetics. It is almost always about the small, consistent daily habits that either protect the postprandial window or ignore it entirely. You now know what that window is. You now know what happens inside it, and you now know exactly what to do about it. Get up from the table. Take your 2 minutes. Your blood sugar will thank you before the hour is out. If this video gave you something genuinely useful today, please subscribe. Every single week, I bring you research-based, practical, honest health information designed specifically for adults over 60 who deserve to understand their own bodies and their own biology completely. And leave a comment below. Are you going to try this after your very next meal? Tell me what you had to eat, and I will be in the comments reading every single response. Take care of yourselves. I will see you in the next one.